It's everyone's worst nightmare. You fell out of a tree or got into a car accident, or you went on vacation and Anthony Bourdained too close to the sun and came back with some third world gigaparasite that lands you right in the emergency room. You're lying in a hospital bed with scratchy sheets, fearing for your life and the $80 charge you'll receive for using a Band-Aid. In America, we face a uniquely horrifying roll of the dice. Will this already terrifying life event, be it an injury or illness, also send you into financial ruin?
Alive, living, live, life.
It's a real possibility. Americans are terrified of our own healthcare system, to the point that health scares feel apocalyptic. But that's exactly what insurance and our dear leaders in Washington want, because the scarier and more expensive healthcare is, the more money we'll give to them to protect us from the beast. The only problem is, they're all having an affair behind our backs. If you've ever felt like healthcare is meant more as a money-extracting scheme as opposed to an industry truly designed to help you sustain a healthy life, congratulations. You've just won a lifetime gift of existential dread because you're not off base. Once upon a time, I was one of the millions of Americans who didn't understand our healthcare system, and frankly, I was too afraid to ask. So if you can relate, welcome. This video is specifically for you. I asked the questions I feared the answers of and compiled them into digestible, bite-sized chunks for you. But I do apologize in advance, they don't go down easy. And I am by no means claiming that America's healthcare system is anything but complex, but it's not impossible to understand. And frankly, politicians and the medical industry want us to feel intimidated so that we can't pursue true consumer-driven solutions. In the process of trying to write a beginner-friendly, big-picture video, I realized that it needed to be at least 2 videos, with the possibility of even more down the road. So this is just part 1. Part 2 will be released a week after this one. Today we'll explore some of the totally illogical laws governing our healthcare industry that almost seem designed to make things worse.
There is no Carol in HR.
Whereas next week, we're going to dive deeper into how we pay for healthcare, how that impacts prices, and what solutions are available to us. Before we begin, I want to shout out this book, Overcharged: Why Americans Pay Too Much for Healthcare, from authors Charles Silver and David Hyman. I have to say, these guys really did the dang thing. This is the comprehensive guide to America's healthcare woes. Highly recommend buying if this video sparks a deeper interest for you. I also pulled in a healthcare scholar and expert, Michael Cannon, author of Recovery, to answer some of the questions I had, so his expertise will be sprinkled throughout this video as well. With that all being said, let's jump in and demystify the biggest problems facing America's patients. We've all heard tales of socialized healthcare from our neighbors in Canada and our toxic ex across the pond, the UK. But did you know that Americans spend more on healthcare than any other high-income country in the world? In 2023, we spent $13,432 per person. And yes, that is far above the average spent in countries with full-blown socialized healthcare systems like Canada, where it came out to little over $7,000 per person. We consume a lot of healthcare. As Michael Cannon writes in his book Recovery, in 2021, the US health sector consumed more resources, $4.3 trillion, than the entire nation of France produced, $3.4 trillion. So why are Americans spending so much money?
Where's the money, man? Where's my money?
As Michael Cannon pointed out in our interview, there are plenty of plausible and frankly good reasons our healthcare is pricey.
Prices for doctor services are going to rise when the opportunity costs are high. Real estate is often expensive, and we develop a lot of the new medical innovations that end up saving lives around the world, usually a large investment in research and development, and then the patent system allows those innovators to charge high prices, and that's how we generate those new treatments, those new tests, and those cures. There are a number of reasons why the U.S. health sector is expensive that are absolutely fine, that are actually making people's lives better. U.S. healthcare is unnecessarily expensive because the government does so much to drive up healthcare prices and price healthcare out of reach of not just low-income people, but middle-income people as well.
But these factors don't even come close to explaining how expensive things have become. Ask any American what the 3 most expensive life events are, and they'll tell you it's going to college, buying a house, and encountering a medical crisis. As a 2026 bride, I can say weddings can be counted up there, but that's no one's fault but our own. As with any sector of the US economy where prices have soared and far surpassed typical inflation rates, something more nefarious is afoot. Both demand stimulation and supply suppression are happening on behalf of the government, and it's causing prices to rise. Let's start with the side of the equation that's easiest to understand: supply-side regulations. Healthcare is incredibly regulated, and I think we can all agree that's happening for obvious reasons. No one wants to pass away on an operating table due to substandard care, but the government doesn't stop at preventing harm. If we're being honest, governments often create worsening quality of care, but that's a deeper discussion. Federal and state level regulations often target the quantity of care, not by giving us more hospitals, doctors, and practices. No, that'd be silly unless you want more options and cheaper prices. Certificate of Need laws are a particularly egregious example of this. Imagine you're a baker and have to go before a board of other bakers and their friends to get their approval to open a bake shop. The board thinks you're going to steal customers away, so they deny your permit and you can't open a business. And so you go and work for the already established bakery and your dreams are crushed. This scenario happens in healthcare all the time. Boards deny providers the ability to open despite having all the necessary requirements and permits because they claim the area doesn't have a need for them. In New Orleans, a social worker named Ursula Newell Davis wanted to open an after-school program to help at-risk children. Love her. The state did not. A board of her competitors denied her the ability to open her business because she couldn't prove the area needed her services. As a Louisiana native, I can assure you New Orleans needs her services. And in many places around the country, it's not just single providers like Ursula, but bigger practices like nursing homes and hospitals who are denied the ability to open by their competitors. Because why compete and be forced to lower costs or provide better services if you can just mark your territory and forbid anyone else cross imaginary lines?
See that? I'm peeing all over your special guns. That means I own them.
The number of doctors in the US is also artificially restricted. Medical schools were prevented from expanding the number of slots for decades, and now the US expects to see a shortage of 122,000 physicians by 2032. Actions meet consequences, hello? And the training doctors are required to undertake lasts anywhere from 11 to 15 years, while in some European countries, doctors can practice after only 6 years of training. It's no wonder that after all of that training and education, which is quite expensive and time-consuming, that doctors will be paid extremely high salaries. And it's no wonder that hospitals are willing to offer those salaries in order to attract talent from a very small pool of candidates. There's also a degree of gatekeeping in the medical field, which prevents mid-level providers like PAs and nurse practitioners from providing care they know how to give, because it threatens physicians' financial standing.
That's my money, Paulie.
Doctors, after spending so much money and time on training, understandably want to see some sort of payoff for their efforts. But it's at the expense of patients and the American taxpayers. Doctors are not evil. They are also being screwed over by our regulatory system. An Obamacare law effectively ended the expansion of physician-owned hospitals by preventing new ones from billing Medicare and Medicaid, again, limiting our supply. So even the doctors who do want to make a tangible difference often can't because of arbitrary rules and regulations. At the risk of sounding like a boomer and doing the "Thanks Obama" meme, the Affordable Care Act, more commonly known as Obamacare, is really an inescapable part of this discussion. Government-run programs like Medicare and Medicaid certainly existed before Obamacare, and our healthcare woes did as well, hence the reason affordable care was even a discussion for voters. But this over 900-page bill became a crucial element of our investigation into rising costs because of how extensive, dramatic, and kind of wacky the changes truly were.
Obamacare did a lot of things. The two big things that it did was it expanded a government entitlement program that we call Medicaid. This was for pregnant women, children, aged, blind, and disabled individuals with low income, so specific populations, people who couldn't provide for themselves, they weren't able to work. Obamacare expanded Medicaid to people who are able to work. And then the other big part of Obamacare was a complete overhaul of private health insurance in the United States. It used to be the case that insurance companies could sell health insurance to people according to the risk that those purchasers brought with them. Before Obamacare, insurance companies could charge healthier people lower premiums, younger people lower premiums. That encourages them to enroll in health insurance before they get sick and they need it. But Obamacare said, no, you can't do that. You have to charge them the same premiums as you charge everyone else, which caused their premiums to double or triple, and created a lot of incentives for them not to buy health insurance. At the same time, those same price controls made health insurance worse for the sick, the people we really worry about and we're trying to get secure access to health care. The United States is about 340 million people right now. We're talking about 10 to 20 million people right now in the part of the market that was reasonably free before Obamacare, but then Obamacare just regulated it into an expensive, low-quality mess.
Not only were government-sponsored insurance programs expanded, fueling the demand-side subsidization, but Obamacare also expanded private insurance through two central components commonly referred to as the individual mandate and guarantee issue. The individual mandate financially punished Americans who did not have health insurance plans by charging them money. Wow, I wonder if the insurance companies wrote that mandate? You won't buy our insurance? That's too bad. We'll just get the most powerful bully in the world to steal your lunch money until you do. Anyways, the individual mandate was egregious, in my opinion. You can't force someone to spend their money on something they don't want. It got repealed at the federal level, but in 11 states, including Washington, D.C., Americans are still penalized if they don't have health insurance. And still kicking around is that old guarantee issue, which forces insurance companies to charge the same rates for everyone, regardless of any extenuating circumstances. Can you imagine if car insurance did that? I know some people who have put their insurance to work and not in a good way. The guarantee issue also forced standardized coverage, which meant most Americans are purchasing insurance we don't need. In fact, Americans are egregiously overinsured. And that's problematic for reasons I will get into in next week's video. But to summarize the issue, insurance increases our ability to pay for things. Doctors, hospitals, and medical practices take note of that and charge us more. As Americans become more insured and insured at higher levels, medical prices have risen far past the rate of inflation. Obamacare was not American healthcare's original sin, although it did increase our insurance levels, leading to higher prices. Our first big misstep was the employer-sponsored insurance tax subsidy passed during World War II, and soon after that, Medicare came along and started causing all sorts of problems. Medicare is our health insurance program for the oldest and wisest among us, and I think anyone watching this video can agree that treating our elderly with respect and care is extremely important. The problem is, Medicare is not designed with patient satisfaction and health in mind. It's a system designed by central planners whose main priority is increasing their budget. And for many doctors, the main priority is extracting as much money as they can out of the program. And so Medicare is rife with waste and fraud. In 2014, the DOJ got $3.3 billion back from fraudsters. Great, thank you for doing your job. But that was a drop in the bucket compared to the false Medicare and Medicaid claims in the same year, which totaled $100 billion. One way medical practices defraud American taxpayers is through a practice called upcoding. It's better that I tell you a story to illustrate this. It's one of many told in the book Overcharged. A group called Prime Healthcare Services was running the operations of several hospitals around California, and many of these hospitals seemed to suddenly experience massive waves of specific diseases and medical maladies that just so happened to trigger major Medicare payouts. One particular hospital in Shasta County had a nasty surge of kwashiorkor cases, which, if you're unfamiliar, is a form of extreme malnutrition typically found in drought-stricken or war-torn sub-Saharan African countries. Coincidentally, hospitals were receiving a cool $6,000 Medicare payment for every one of these patients. And when California Watch uncovered this medical mystery, suddenly, all of those cases miraculously disappeared. Thank you, Prime Healthcare Services, for literally ending starvation's career. We salute you. But it took journalists fighting for those records and bringing it into the light of day for real action to be taken. Because the truth is, Medicare has little incentive to save our money and fight fraud. Nor do they have the incentive to try to cut down on wasteful spending and procedures. It is truly shocking how many procedures are viewed as routine parts of our experience with the American medical system that are totally unnecessary, if not actively harmful. These often persist in spite of updated information that proves them to be ineffective. Why? Because of Medicare payouts and the deep lobbying ties the medical profession has with Washington, D.C. Antibiotics? I'm looking at you. Did you know that a third to half of all antibiotics prescriptions given out every single year are completely unnecessary? And the overuse of these drugs is creating antibiotic-resistant bacteria, rendering these life-saving medications ineffective when patients actually need them. Some doctors claim that patients just want them to do something, so they write a script. First of all, that is not how medicine works, but I'm also thinking the increased Medicare payout might have something to do with their unwillingness to stop ordering unnecessary prescriptions. A medical journal in 2008 claimed doctors could make an additional $8,393 per year by writing one additional prescription a day due to Medicare's reimbursement structure, which incentivizes writing prescriptions. Some doctors try to fight this system and place their patients' needs before the financial incentives, but good doctors can't fix a bad system. It's not just greedy doctors or bad incentives. It's the number of added employees a doctor or practice must hire just to administer the Medicare, Medicaid, and insurance claims that help drive up the costs. Hospitals, too, are incentivized to not protect their patients and often have higher payouts from treating disaster stage illness as opposed to preventing it.
My ideal healthcare system is one where the government respects everybody's equal rights and equal dignity and lets people make their own healthcare decision. But otherwise, where the government leaves us alone to exercise our right to choose what medical treatments we take, exercise our right to choose our healthcare providers, whether and how to pool our healthcare expenses. Because what we would see in that sort of a marketplace is we would see markets doing in healthcare what they do in every other sector of the economy, driving down prices while improving quality. And that is how you make healthcare more universal. A free market in healthcare would be a more universal health system than any health system that any government has designed.
This means quality of care is often not the priority, and the government not only enables bad behavior, it directs providers towards it. And when the medical field gets something wrong, when treatments or tests prove to be ineffective and costly, the medical field can't reform because too many dollars are at stake. Mammograms and PSA screenings for prostate cancer are examples of two practices most Americans will participate in at some point in their lives, maybe multiple times, and yet there is a body of evidence against their efficacy. The medical field can be very inflexible. We often mock the bloodletters of the past, but there are certainly practices we do that our grandchildren will think are crazy. That is, if we let those ineffective industries die. But unfortunately, too many people are making money, including those in power. In 1994, the Agency for Healthcare Policy and Research issued recommendations against surgery for lower back pain and showed that spinal fusions caused more complications and kept people in the hospital for longer. So naturally, we would have phased out that practice, right? No, surgeons got together and fought Congress to get the agency's budget reduced. The number of spinal fusions tripled in the following years. And when private insurance has tried to fight against unnecessary care, they've been targeted by the medical industry for being uncaring and cruel. We simply spend and use too much healthcare, and that healthcare often happens at the later, more pricey stages of disease. It's estimated that a third of all medical spending in America is fraudulent, wasteful, or unnecessary. Economist Robin Hanson goes a step further and claims we could cut health spending in half without harming our nation's health. Crazy! That's the equivalent of an 8% pay raise for working Americans and saving $1.7 trillion every year. So why don't we do it? There are too many people making too much money to ever stop. We have directed an enormous amount of American dollars through the healthcare system, and good and bad people alike are making a living off of it. Doctors are making money off of Medicare payouts and procedures. Politicians are making money from lobbyists who support their campaigns. Health insurance providers are making lots of money off of the monthly payments and the kickbacks they get from provider partnerships. And you, the consumer, are getting poked, prodded, scanned, screened, and robbed blind. In this video, we've covered how government involvement in healthcare has made all the power players rich and cost the public tremendously. But in the next video, we'll talk more extensively about the demand side of healthcare and how insurance has potentially harmed us more than it's helped. Crazy, I know. I'm excited to see you all next week. Click the bell for notifications for when this video gets posted. And if you're watching this in the future and need to take a break like I do, I will see you 1 minute from now. Okay, ciao.